Have you ever noticed blurry vision or halos around lights at night and brushed it off as just getting older? What if I told you these could be early signs of glaucoma, a condition that affects millions worldwide, often without being detected until it's too late? In today's video, we're going to explore the subtle signs of glaucoma, the second leading cause of blindness globally. Many symptoms are so subtle that they go unnoticed, putting your eye health at serious risk. I'll walk you through what to look for and why catching it early is crucial to saving your vision. Stick around, because recognizing these signs could make all the difference. Imagine you're going about your day, doing the usual things, when suddenly you start experiencing some blurry vision. But you brush it off as just tired eyes. What if that's the first sign of something much more serious, like glaucoma? Glaucoma is the second leading cause of blindness worldwide. But here's the kicker. Most people don't even realize they have it until the damage is already done. According to the World Health Organization, over 60 million people globally are affected by glaucoma, yet half of them are unaware of their condition until it's too late. So when it comes to eye health, ignoring the early symptoms can have long-lasting, irreversible consequences. The truth is, many of us don't think about our eye health until we start seeing symptoms, but by then, the damage could already be done. So, why does early detection matter? Well, catching glaucoma early is one of the best ways to protect your vision. You see, glaucoma signs can develop slowly, often without noticeable symptoms. But if you're aware of what to look out for, you can spot potential warning signs before they lead to irreversible optic nerve damage. In this video, we're going to go through the signs you need to watch out for, simple, easy-to-identify symptoms that can help you detect glaucoma early and save your sight. At its core, glaucoma is a condition that affects the eye, specifically the optic nerve. The optic nerve, which sends visual information from your eyes to the brain, can suffer damage when the pressure inside the eye increases, something called intraocular pressure. Over time, this increase in pressure can damage the nerve, leading to vision loss. In fact, without treatment, glaucoma can cause permanent blindness. It's often called the silent thief of sight, because symptoms can creep up so gradually that you may not even notice the damage until it's too late. So, understanding the condition is essential if you want to stay ahead of it. Blurry vision is one of the earliest and most common signs of glaucoma, particularly when it affects peripheral vision. Unlike central vision, peripheral vision is harder to notice, making it easy for gradual loss to go undetected. You may notice that objects at the edges of your visual field seem a little less sharp, or that you're having trouble focusing on things that aren't directly in front of you. Over time, this blurriness can become more pronounced, making everyday tasks more challenging. If you experience this, it's important to address it promptly, as early detection can prevent further damage. Another red flag to watch for is a frequent need to change your glasses prescription. Glaucoma can cause blurry vision, which might make you think that your lenses are outdated or no longer effective. However, if your vision doesn't improve even after updating your prescription, it could be a sign that there is an underlying issue, like rising eye pressure. Many people find themselves adjusting their prescription, often without realizing that the problem lies elsewhere. If this happens, it's a good idea to visit an eye specialist for a more thorough checkup. Eye pain or pressure is a significant symptom of glaucoma, particularly in its more advanced stages. You may feel a dull, constant pressure or sharp, throbbing pain in one or both of your eyes. This type of discomfort is different from the mild irritation or dryness you might experience after a long day. Eye pressure related to glaucoma tends to be persistent and often gets worse over time. If this is accompanied by blurry vision, headaches, or other visual changes, it's essential to consult a doctor right away, as this could indicate elevated eye pressure that needs immediate attention. Have you ever noticed halos around bright lights, especially at night? This is another common sign of glaucoma. Halos appear as glowing rings surrounding light sources, which can make it difficult to focus on the light itself. This happens because the increased pressure inside the eye causes light to scatter, creating visual distortions. If you notice halos more frequently, especially when driving at night or in dimly lit rooms, it could be an early warning sign of glaucoma. Pay attention to these symptoms and seek medical advice if they persist. Peripheral vision loss is one of the most concerning symptoms of glaucoma. Since this change occurs gradually, many people fail to recognize it until significant damage has already occurred. You might find yourself bumping into objects, missing things in your peripheral vision, or feeling like your field of view has become narrower. Glaucoma tends to damage the outer edges of the visual field first, leaving central vision intact for a while. As the condition progresses, this narrowing can become more pronounced, making it harder to navigate everyday activities. In addition to blurry vision and eye pain, nausea and vomiting can also occur, especially in acute cases of angle closure glaucoma. When the pressure in the eye increases rapidly, it can cause severe discomfort, along with nausea and vomiting. This type of glaucoma is a medical emergency and requires immediate treatment to prevent permanent vision loss. If you experience these symptoms alongside any other eye discomfort, you should seek medical help immediately. Glaucoma is often referred to as the silent thief of sight because many of its early symptoms are subtle and can be easily ignored. People often dismiss blurry vision or halos as signs of tiredness, eye strain, or the normal effects of aging. However, if left unchecked, these symptoms can progress and cause permanent damage to the optic nerve. Regular eye exams are crucial, especially if you're experiencing any of these symptoms. Only a comprehensive eye test can detect the signs of glaucoma before they cause irreversible harm. Peripheral vision loss, in particular, is a tricky symptom to detect because it happens so gradually. Many people with glaucoma don't realize that their field of view is narrowing until it becomes difficult to see objects on the sides. This is why it's important to monitor any changes in your vision over time, as this gradual loss of vision can go unnoticed until it's too late to treat effectively. Keep track of any changes in your vision and seek medical attention if you feel something is off. A family history of glaucoma can increase your risk of developing the condition. If glaucoma runs in your family, it's even more important to be vigilant about eye health. People with a family history of glaucoma should consider having regular eye exams, even if they don't show any symptoms. Early detection can significantly reduce the risk of vision loss. If you have a relative who suffers from glaucoma, talk to your doctor about starting routine eye exams earlier than recommended. Glaucoma doesn't only affect older adults, it can occur at any age, although the risk increases with age. That's why it's essential for everyone, regardless of their age, to be aware of the symptoms and take them seriously. Early intervention can help preserve vision and slow the progression of the disease. Even if you don't experience obvious symptoms, regular eye exams are key to detecting glaucoma in its early stages, when treatment is most effective. Finally, while glaucoma is a serious condition, it is treatable. The earlier you seek medical attention, the better the chances of managing the disease and preventing permanent damage. If you notice any of the symptoms of glaucoma, whether it's blurry vision, halos around lights, or eye pain, don't wait. Make an appointment with an eye care professional as soon as possible to discuss your symptoms and get the care you need to protect your vision. Early detection and treatment can make all the difference in preserving your eyesight. Many of the early symptoms of glaucoma develop so slowly that people don't even realize they're happening. Blurry vision might just seem like a result of long hours at the computer or a late night. Halos around lights might be dismissed as something related to being tired or having dry eyes. Because these symptoms come on gradually, it's easy to overlook them or dismiss them as normal aging or environmental factors. However, ignoring these signs can lead to permanent damage. Let me tell you about a friend of mine who had a very similar experience. They started noticing blurry vision in one eye and thought it was just because they were spending too much time in front of a screen. A few months went by, and the blurry vision started to affect both eyes. Eventually, they started seeing halos around streetlights at night. But they kept putting it off, thinking it was nothing serious. By the time they finally saw an eye doctor, they were diagnosed with advanced glaucoma and had already lost some peripheral vision. That's why it's so important to listen to your body and seek help when you notice any of these early signs. Although glaucoma can't always be prevented, there are steps you can take to slow its progression. For starters, get regular eye exams. These exams are essential in detecting glaucoma early and preventing optic nerve damage. Controlling your blood pressure and maintaining a healthy diet rich in vitamins A and C can also support your eye health. If you have a family history of glaucoma, it's even more crucial to have regular checkups. If you experience any of the symptoms we've discussed, blurry vision, halos around lights, eye pain, or peripheral vision loss, don't wait. See an eye doctor immediately, even if the symptoms seem mild. Catching glaucoma early can help protect your sight. If glaucoma is detected early, there are several treatment options that can prevent further vision loss. Doctors may prescribe eye drops to lower eye pressure or recommend laser therapy or even surgery in more severe cases. The key is early detection. The sooner you take action, the better the chances are that you'll preserve your vision. If you've experienced any of these signs, or if you just want to be proactive about your eye health, make sure to schedule a checkup with your eye doctor. Regular eye exams are the best way to catch glaucoma before it causes permanent damage. And if you have a family history of glaucoma, be even more vigilant. Don't wait until the damage is done. Your vision is too precious to ignore these warning signs. Share this video with anyone you think could benefit from this information, because we all deserve to see the world clearly for as long as possible. If you found this video helpful, don't forget to hit the like button, subscribe, and click the bell for more updates on eye health. And before you go, don't stop here. Click the next video on the screen to keep learning how to protect your health and live your best life.